Recently say that no matter who you are or where you live, cancer may touch your life. It is therefore necessary to understand the warning signs of cancer, your risk of the disease, and what's normal, so you can take action if there are any changes in your body. Hello there and welcome to this week's episode of Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. Thanks for tuning in. I am Rabi Abdullah. The burden of cancer underscores continuous conversation around it from different perspectives. On this episode of the program, we shall focus on two cancers that affect women, talking about breast and cervical cancers and the needed support. Join us on Nature's Scanner as we take you through medicinal plants that contain anti-cancer properties and the renewed impetus at harnessing them for the health benefits of the populace. You will get to meet my guests in the course of the program. This is Health Options, and as we discuss breast and cervical cancers in women and the needed support, I have with me a prominent advocate when it comes to concerted efforts at turning the tide of cancer in the country. I am referring to no other than the immediate past First Lady of Kebbi State and founder, Medicaid Cancer Foundation, Her Excellency, Dr. Zainab Bagudu Shinkafi. It's good to have you with us again on Health Options, Your Excellency.
Thank you very much for the invitation. It's a pleasure to be here, Haji Arabi.
Okay, nice to see you indeed. At the beginning of my introduction, I said, no matter where you are or who you are, there are chances that you might just come down with cancer, but nobody prays for that, even for his worst enemy. And here we are again talking about it because we just have to keep talking about it. Information is key, and it gives you the option to know what to do. It's all about sensitization, and it's good that we're still on that page as we are. So let's start with cancer, in general, before we narrow it down to our focus, which is breast and cervical cancers in women. You are an advocate, you're a medical expert, you're a woman. You've been out there, you've occupied political office, and you've seen it all. Let us into cancer as a health condition.
Well, first of all, cancer is one of the most dreaded diseases that anyone can wish for. And as you rightly say, we have been consistent, yourself inclusive, in spreading the education that it deserves. It is a condition that can be prevented in many cases, but unfortunately it is very complicated, and when it comes, it's also very expensive. Basically, cancer is an interplay between the immune system, what is natural for our body, natural cell turnover, but when that process becomes disrupted by different agents, which I'm sure we'll come into, it turns over at an abnormal rate, and you have the tumor formation and the cancer develops. The vulnerable people in the world that develop cancer are from low middle income countries. The incidence is higher. The mortality, that is the number of people that die from cancer in our parts of the world, is very high.
So we'll start with breast cancer because it constitutes the highest burden when it comes to female-related cancers. And we know factors fueling it. But even at that, we know that though preventable, where is the negligence coming from? Is it as we, women as individuals, or is it just something that just...
There is no joy in seeing the people of this nation shoulder burdens that should have been shared years ago. I wish today's difficulties did not exist, but we must endure if we have to reach the good side of our future. My government is doing all that it can do to ease the load.
for the invitation. It's a pleasure to be here, Haji Arabi.
Okay, nice to see you indeed. At the beginning of my introduction, I said, no matter where you are or who you are, there are chances that you might just come down with cancer, but nobody prays for that, even for his worst enemy. And here we are again talking about it because we just have to keep talking about it. Information is key, and it gives you the option to know what to do. It's all about sensitization, and it's good that we're still on that page as we are. So let's start with cancer, in general, before we narrow it down to our focus, which is breast and cervical cancers in women. You are an advocate, you're a medical expert, you're a woman. You've been out there, you've occupied political office, and you've seen it all. Let us into cancer as a health condition.
Well, first of all, cancer is one of the most dreaded diseases that anyone can wish for. And as you rightly say, we have been consistent, yourself inclusive, in spreading the education that it deserves. It is a condition that can be prevented in many cases, but unfortunately it is very complicated, and when it comes, it's also very expensive. Basically, cancer is an interplay between the immune system, what is natural for our body, natural cell turnover, but when that process becomes disrupted by different agents, which I'm sure we'll come into, it turns over at an abnormal rate, and you have the tumor formation and the cancer develops. The vulnerable people in the world that develop cancer are from low middle income countries. The incidence is higher. The mortality, that is the number of people that die from cancer in our parts of the world, is very high.
So we'll start with breast cancer because it constitutes the highest burden when it comes to female-related cancers. And we know factors fueling it. But even at that, we know that though preventable, where is the negligence coming from? Is it as we, women as individuals, or is it just something that just...
There is no joy in seeing the people of this nation shoulder burdens that should have been shared years ago. I wish today's difficulties did not exist, but we must endure if we have to reach the good side of our future. My government is doing all that it can do to ease the load.
Your life.
Art is a way to express many things. It is also a way to deal with feelings that cannot be expressed through typical means like conversations or words. Art gives a way to express your emotion. It is the universal form where the imagination of thought interacts with the physical expression of matter. Art is the diverse range of human activities in creating visual, auditory, or performing artifacts, expressing the author's imaginative, conceptual, technical skills intended to be appreciated for their beauty or emotional power.
Art on its own, from the beginning, has been that thing, that place there where you say you pass corrective messages to people. You understand? You put a correction to the society. They see the ills in the society and they put up some kind of corrective measures.
Yes, I love arts because like you can see today, you could see creativity, you could see the Africanism, let me use the word Africanism. You could see a whole touch of excellence. So it's I think Abigail has done so well in creating the space of arts.
City People too plays around with the subject of African contemporary living and especially the Nigerian experience. Abigail Naji's beautiful pieces features lovely paper cuts, geometric forms, strong, bright colors, gentle strokes, and flowing lines gives the effect of a visually attractive composition that allows the viewer to get a comfortable view with the piece.
I created this artwork to show, the title is Blooming. So you can see there are so many lines and colors. So what I was trying to interpret is that, as a human being, each individual we're different. And at some point we begin to get better at what we do. And so that's why I used the title Blooming. That means you're getting better, you're becoming, brighter in everything, every aspect of, your own personal struggle. Because I did it based on the theme.
That we advocated for that, but unfortunately we have accessible in all our primary healthcare centers, community leaders, everybody about the benefits of this vaccine, which is, I've said clearly, it prevents cervical cancer. It is the one cancer that can be eliminated because we have all the tools at our disposal. What we need is the political will and the efforts, as well as the acceptance to ensure that it reaches every girl. And by the way, it's not just a vaccine meant for girls. We start with girls because they are the ones that develop cervical cancer, which is the highest killer. HPV also causes things like anal cancer, oral cancer, and mouth cancer. Yes, oral cancer. So boys are also advised, or they are recommended to have it. In other countries, it's given to both boys and girls, even some African countries. And I personally believe that this is the way to go to reduce the worry and suspicion that we are vaccinating just girls for other reasons. When it is made by gender, then that way we can be sure that we're not trying to prevent our girls from having children, which is the usual suspicion.
The northern part of the country has its peculiarity. I'm saying this based on what had happened in the past with the polio vaccine and all of that. I don't know, is your foundation already in synergy with, community leaders and, the other key players who should really drum this, into the ears of, parents and beneficiaries?
Definitely, not just Medicaid Cancer Foundation, but a lot of other civil society bodies that are working at the community level. We work with the traditional rulers and religious rulers. In particular in Kebbi, we have a lot of support from His Eminence, His Royal Highness, the Emir of Argungu, who has become a worldwide figure when it comes to vaccination, particularly in polio. So by working with them and ensuring that we have their support and buy-in, we have been able to make the acceptability easier for the people. We've done a vaccine pilot in Yauri in Kebbi State. It was such a smooth process. Today, instead of having no, don't come, what we see is almost from every week, every month, I get a call from somebody in Yauri saying, when are you coming to vaccinate the rest of our girls? So people see the numbers in Kebbi. It's a small state relative to some other states, and they wonder why Kebbi is included in the first round. But because of the level of awareness that we've created, the acceptability, as well as the ability to generate the required demand, I believe these are the reasons that made the National Primary Healthcare Agency include Kebbi. The agency also works with Traditional Rulers Council. I know the Sultan of Sokoto heads that, and he's also very prominent and plays a role in teaching people and letting our people know that this is not a bad thing. this is something that we need to do to improve the outcome of the disease. There are African countries that are on the pathway to the elimination agenda. And unfortunately, we are starting late, but I have no doubt that because of the way Nigeria is and the way we're known to get on board something when we buy and key into it, we will also be on that path very soon.
So thank you so much, Dr. Zainab Abagadushinkafi, immediate past First Lady Kebbi State and founder, Medicaid Cancer Foundation, I beg your pardon. And please keep up the good work. Thank you so much for coming on Health Options.
Thank you for having me once again.
Unwrap joy, unleash taste.
Let's now take you to our nature scanner, where the Director General, Nigerian Natural Medicine Development Agency, Professor Martins Emeje, will take us through plants with anti-cancer properties and what the agency is doing in terms of research and development in that area. Speak to cancer as a professional to start with.
Okay, thank you. And again, I'm glad to be here. And I'm also happy with your prologue, because the truth is, when we begin to hear from people like you and from a professional media organization like NTA, that look, there's no way we can defeat cancer by depending on conventional or what we call synthetic drugs, then we are making a headway. And those of us who are in this area, we know that natural products work. And we can tell you that the natural product in another country can never be as good as the natural product of that country for their own people. Because the solution to the problem in the environment is in that environment. We are growing anti-cancer plants in Nigeria on our research farms. Government has given us the mandate to ensure that we make anti-cancer products from our own Nigerian medicinal plants, and we have them. But it's not all the local governments in Nigeria that have the medicinal plants for treating or managing cancer. Because it's also not all local governments that have all types of cancers. So what we do, our medicinal plant, for example, in Ikorodu, we plant in Ikorodu F4 because we know that we will be harvesting it and making products for prostate cancer. That's an example. So in Jesse, in Delta State, where we have another medicinal farm, we have planted Andrographis paniculata, which is called king bitters, for making products for breast cancer and for prostate cancer and for uterine cancers. So that's what I mean when I tell you that we have research farms and we are supposed to have them in all the 774 local governments. Now we have them in only 6 because of obvious lack of funds to do that. But we already have our framework, we have our roadmap, we have our plan, and once we have the funds from government and from the private sector, more importantly, we will be able to do this. Because a lot of our people who go to pay 4 million naira, 4 million naira to use natural products from India and China in Abuja, that 4 million naira, if you give it to us, for only 4 million naira, if you give it to us, we will bring out one product. If a private sector will give us that money, we will make products from our own natural product, and we will say, look, Mr. Labaja is the one that provided the funding for us to develop this anti-cancer product. My minister, sir, I want you to approve that government and Mr. Labaja should co-own the product that we have made. That is how it is done in functional, in developing other clients, and that's why things are moving.
Okay.
Where we are at the moment is on our own, based on funding from government 100%. We have two products, one for two anti-cancer products, one for breast cancer, one for prostate cancer.
Okay.
And we are yet to commence clinical trials of those products. And as you know, even though we already have NAFDAC listing registration for 5 of our products, these 2 are yet to have NAFDAC nodding because we have not presented it to NAFDAC. But as scientists and as professionals, we can tell you that this is what they are, and we will be presenting it to NAFDAC soon. Then, but more importantly, it will now join our retinue of approved drugs, list approved drugs from NAFDAC, ready for clinical trials. And we have to do clinical trials because it is after the clinical trials that we will be able to say, look, government, these products are available for use in our formal hospitals.
I absolutely agree with you, Prof, and we look forward to you turning our products that will benefit Nigerians and ensure, better health care for the populace. Thank you so much for your time on Health Options. It's been nice talking to you. Thank you.
Thank you. It's always a pleasure to be here.
Remember that early detection of cancer guarantees higher chances of survival. So go get screened and play your part in the war against cancer. And that does it on this week's episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. My name is Rabi Abdullah. Thanks for watching. Do stay safe.